I've proposed to increase the alcohol tax and expand the tobacco tax in my 2012 budget. Our proposal will extend the county tobacco tax to loose tobacco, smokeless tobacco, and cigars, closing an important tax loophole. The alcohol tax proposed is a modest increase over an outdated tax policy that was last amended in 1989. We're asking wholesalers to pay an additional 3 cents on a gallon of beer. That's less than 2 cents on a six-pack. As a result, Cook County will generate roughly $11 million in new revenue. It's important to note that the overall tax on alcoholic beverages is declining due to the rollback of the sales tax. In the end, consumers will pay less than they presently pay. Quite simply, everybody will get a tax break. But we decided that it was appropriate that there should be a bigger tax break on toothpaste and baby formula than booze. Beyond being fiscally responsible, adjusting the taxes on alcohol and tobacco is sound public policy because it supports our public health and public safety services. One of the primary mandates of Cook County government is the provision of health care. It's our responsibility to ensure that our budget reflects that commitment. Tobacco and excessive alcohol consumption are the first and the third causes, respectively, of preventable deaths in the United States. I'm going to say that again. Tobacco and excessive alcohol consumption are the first and the third causes, respectively, of preventable deaths in the United States. Together, they account for more than 1 in 5 U.S. deaths, more than 20%. Tobacco and excessive alcohol can cause harm to every major organ system, impairing the quality of life for tens of thousands of Cook County residents through cancer, heart disease, emphysema, and other diseases. In addition to the enormous health impacts, there are significant social costs attributed to tobacco and excessive alcohol use due to lost productivity, the need for more health care, accidents, and crime. Increases to alcohol and tobacco taxes reduce consumption and thus help to reduce the societal costs. That's why we're here today. I'm grateful to the doctors and the healthcare professionals who have joined us. They see the devastating effects of alcohol and tobacco use every single day. Some of the executive medical staff at Stroger Hospital recently brought some disturbing statistics to my attention. Smoking currently costs the U.S. economy nearly $200 billion annually, and the costs of excessive alcohol consumption are another $225 billion. So more than $400 billion in costs. And these translate into $7 billion in Cook County alone. Put another way, each pack of cigarettes incurs costs to society of more than $10, while each standard drink of alcohol costs society nearly $2. We feel strongly that this is the right thing to do, both from a fiscal standpoint and a policy standpoint. There have been numerous studies that support this approach as an effective way to promote public health and public safety and pay for the services that government provides. But special interests are attempting to persuade you otherwise. They will make it seem as if their niche industry represents everyone's interests. Quite simply, we are calling on commissioners to act in the interest of the greater good and vote for sound public policy. The board is expected to vote on this on Monday. That's 5 days from today. We have a chance to implement sound fiscal policies that promote public health and safety and benefit our health care system. I hope my colleagues on the county board will join me in this effort.
It's really a privilege to be standing here with some of the elected leaders as well as the iconic medical staff who really work every day in and day out to provide care to the residents of Cook County. So it is I'm here happy to stand with the President in support of what I consider an important public health measure today of increasing tax on tobacco and alcohol. Tobacco and excessive alcohol consumption are easily, as President noted in her speech, number one and number three causes of preventable health care in the United States, together accounting for more than 1 in 5 deaths in this country. Tobacco and excessive alcohol use harm every major organ system in the body, impairing the quality of life of tens of thousands of Cook County residents. You walk into Stroger Trauma any weekend night, and you will witness firsthand the devastation caused by alcohol abuse. In addition to enormous health impacts, there are tremendous social costs attributed to tobacco and excessive alcohol use due to loss of productivity, added healthcare costs, and accidents. Smoking currently costs the United States economy nearly $200 billion, as President alluded to, and excessive alcohol adds another additional $225 billion, translating that into $5 billion to Cook County taxpayers. This proportion of social cost of tobacco and excessive alcohol use borne by government through the delivery of the health care, payment for disability, and support for criminal justice and public safety systems. Given the major health, criminal justice, and public safety roles of the Cook County government, this county is appropriate level of government to collect these taxes because they basically support these services which see the devastation of both tobacco and alcohol abuse. Strengthening our local tax policy, as the President has outlined today, is an important element of a sound preventive strategy to lessen the risk and impact of tobacco and excessive alcohol. There are times when taxes do improve health. Taxes on tobacco products and alcohol are known to be powerful public health intervention that saves life, reduces illness and suffering, and decreases healthcare costs. Taxes on alcohol reduce excessive consumption of alcohol-related illness and injuries. When the cost of alcohol is higher, younger people are less likely to drink, and if they do drink, they drink less. President's proposal will extend the county tobacco tax to loose tobacco, smokeless tobacco, and cigars, closing an important loophole. In conclusion, both from the public health point of view and the societal good perspective, this proposal of tax increase makes a lot of sense to us. Thank you.
Tobacco consumption is at a all-time high in the minority community around the city of Chicago and around Cook County. And it is my job to try to help deter that. Young people is my most concern. Those young individuals in my community who are now starting to use tobacco at a much younger age. They're getting to the grade school age. And that consumption is really out of hand with our community right now. And so whatever we can do to deter that, and I think this tax may be able to assist us in doing that, we have to help enforce that opportunity to help give these kids a better quality of life. I'm here to promote with the President and working with my colleagues on the county board to make sure we're doing our best job to work with the Cook County citizens, hospitals like Stroger, here at the Stroger Hospital, to make sure that we're helping to keep our staff, who's helping to make these issues very prevalent to us, at the forefront of Cook County. And so again, I'm here to support President Preckwinkle, Dr. Raju, and the work of you, our healthcare specialists around Cook County.
My name is Joel Afric. I'm the President and CEO of Respiratory Health Association, which is committed to reducing the burden of tobacco on our community. We applaud President Preckwinkle for closing this important tax loophole. The tax loophole that places a tax on packs of cigarettes, but places no tax on the mini cigars that look so much like them. Tobacco is an equal opportunity killer. Tobacco products of all types kill, make people sick. Yet under the current system, without a tax on loose tobacco, small cigars, and chewing tobacco, you make those products less expensive and therefore more affordable to our youth. By closing this loophole, we are going to do three things. One is we are going to cause some youth to decide it just costs too much to use these other tobacco products, and we will have lower rates of youth smoking. Second, a smaller percentage of the adults will decide that's it, it's time to quit. And third, For those adults and children who unfortunately continue to smoke, at least they will be bearing a fairer share of the burden that tobacco places on our community. This is a loophole that our federal government closed 2 years ago, and we applaud the leadership of President Preckwinkle in seeking to close that loophole now. She is saving lives through this measure.
I'm Dr. Tom Anderson, President of the Chicago Medical Society. I'm joined here by Dr. Peter Orris, who is the 6th District President, which is the district that includes the Stroger Hospital. We represent 17,000 physicians who care for 5 million people in the county of Cook. The Chicago Medical Society endorses the proposed alcohol and tobacco tax by the Cook County Board President Toni Preckwinkle. We're getting into the holiday season. Think of it as a layaway payment plan on the health care that will be required, a few pennies for each usage, so that when those diseases that are associated with tobacco or excess alcohol catch up with you, the county will have some resources to try and care for you. We wholeheartedly support an increase on the unit price of alcohol. The evidence strongly shows that such taxes are highly effective in reducing excessive alcohol consumption and related harm. Public health benefits are going to be proportional to the size of the tax increase. The CDC released a major report this month on the economic costs of excessive alcohol consumption in the United States. On a per capita basis, the economic impact of excessive alcohol consumption in the U.S. comes to about $746 per person, most of which is from binge drinking. Evidence-based strategies for reducing excessive drinking should be widely implemented. The cost to government in 2006, countrywide, was around $94 billion. That works out to about 80 cents per alcoholic drink consumed as a health care cost. With these statistics before us, the Chicago Medical Society encourages the commissioners to approve President Preckwinkle's common sense proposals to improve the health of Cook County residents. We strongly encourage the Cook County Board to use the money from this ordinance on the county health system. Thank you.